Hi, I am Becky Meagher and welcome to Transitions Body, Mind, Spirit. Transitions, we all have gone through different transitions in our life, and I like to use the metaphor of triathlons, something I've been doing about 13 years. And in a triathlon, first you swim, then you get in the transition area, and then you bicycle, and then you transition again, and then you run. And because we have so many different transitions in our life, whether it be high school or college or different physical things, particularly if you're any kind of athlete, lots of times you need somebody to help you in your transition to away from pain, away from injury and into healing. And we have an amazing person today who is really the star of the triathlete world in Nashville. Wolfe, who is a physical therapist and who just opened up his own private practice. And Chris, you are here today.
Yes.
Thank you for being here.
So good to be here. Thank you.
Yes. And this is the second show that we've done with Chris. The first one, if you want to know all about his background and where he started and all that, see that show. But tonight, this is a particular kind of thing that we are going to be demonstrating. What does a physical therapist do? And for the folks out there, tell us in a nutshell, what does a physical therapist do? Why do we need your talents?
You know, physical therapy, again, it means different things to different people, but primarily physical therapists are movement experts. We are taught and educated and learn to help the body move appropriately. That can be everything from how a neck is turning, bending, how a shoulder is moving overhead, how the back is going to move, hip, knee, ankle. When we deal with an injury, many times our body doesn't move appropriately, and we need to accelerate that healing so that way it gets back to bending, moving appropriately. That's when we can get back to walking, running, jumping. So that's pretty much what a PT is designed to do. Now that can be improving flexibility, improving strength, improving endurance. Sometimes it's just helping possibly a knee not be swollen, not be painful, improve its range of motion, its ability to bend, its ability to straighten, and then teach it how to become strong and accept the loads that we put on it through our daily lives.
Mm-hmm. That's a very good explanation. And you're going to be demonstrating different modalities, different things that you do. And I'm going to be one of the guinea pigs because I literally did have a knee thing going on just last week. And Chris miraculously was extremely helpful. And he's going to show techniques that he has done. And then we have a special guest who has had a TV show of his own, Dr. Kirk Jones, and he is our guinea pig today. And he is laying here, and Chris has worked on him also.
That's right.
After going to Todd's class at Endeavor Performance, which is a big bicycle thing, which I do also. And so today we have Dr. Kirk Jones, who is graciously added his body to demonstrate dry needling.
Yep.
So I'm going to let you explain what is dry needling, and you're going to show the folks at home what it's all about. And thank you, Dr. Kirk Jones.
Yes, thank you very much. So as a physical therapist, trained in several different types of modalities, and trying to utilize those to the best of our abilities to get the best results, the quickest results. Dry needling is actually where we insert a small needle. There are different thicknesses, different lengths. We insert that into actual muscle tissue, sometimes tendons and ligaments, creating a small lesion in order to help promote healing. Sometimes we use that to help the muscle to relax. We all know what a trigger point is. You know, we feel those like in our shoulders or like in our neck where the muscle kind of knots up. We kind of rub on those and mash on those, and sometimes that makes it feel a little bit better. This is a similar technique, but we're actually going to be inserting a small needle into that muscle knot in order to help it to relax. So massage is very superficial on the skin. It has its place. Some areas are very hard to get to, and a needle a lot of times will help to facilitate quicker healing, quicker relaxation, so that way we can move on to other things that are needed. So it's just a modality in order to help move on to other things. I'm going to demonstrate that on Dr. Jones here. So if I were to prop his leg up on me, many times, working with some athletes, runners, cyclists, they come in with a calf problem, sometimes just a strain, sometimes just tightness. Sometimes this technique is used for a knee that may be kind of swollen. Right now, we're going to kind of pretend that Dr. Jones here has maybe like a gastroc problem or a posterior tibialis problem, which is a muscle that sits right behind the shin bone. We're all very familiar with shin splints. We've heard that. Maybe most of us have experienced that. And one technique that we can perform to help heal that is to do some dry needling to that area. So my first technique is one, I usually use gloves all the time. I will palpate, feeling on him where that muscle belly is. Many times it's tender, so I'll go after sometimes tender areas, sometimes non-painful areas as well. I know where the certain nerves and arteries are located. I know where to stay away from certain parts of the body. That's when many times I get those questions. But as we study this and practice this, we know what part of the body to kind of stay away from. So from here, I palpate his muscle in his calf. I flick that needle just into his skin. And unlike acupuncture, which stays very superficial on the skin, this is actually going to go into his muscle. I'm using a 2-inch needle here. I don't necessarily have to use all of that, but because I'm using it on his calf, most of the time I will. He's got a very large muscle mass here. And I just slowly work that into the muscle. Sometimes the muscle will kind of twitch, which is not a bad thing. It's actually doing something very good for him. A lot of times it's that calf muscle relaxing. I can feel the tension there. Sometimes the muscle will grab a hold of it, then relax. I can leave it there in that spot, or I can move it and also find other areas within his calf to work. I can leave it in that area and then work my way down the entire muscle belly, down into the tendon, where it's going to go all the way to his foot and attach there. So if I wanted to do another location, each needle is in like a little plastic sheath here, so it keeps it protected. I rest that on the skin, and then I do a quick flick. And then again, I work that into his muscle there. People always ask me if this is painful. Sometimes it's a little achy. Sometimes you get a little sharp twinge, but then it usually fades very, very quickly. It's not something fast. I work it very, very slowly, just to optimize best results.
Are you twisting that needle also?
I'm not actually. I'm actually just inserting it very, very slowly. I can twist the needle. That technique is kind of called tenting. If I wanted to twist it, actually the muscle fibers would tighten up a little bit more. There are certain times I do want to have that occur. In this particular instance, I'm not. I'm actually just inserting it very, very slowly straight down. And there are certain other techniques I can perform with that in order just to kind of maximize results. This can be done all the way from the great toe all the way up to the base of the neck, sometimes the face, into the shoulder. Again, we're inserting it into muscle, tendon, ligaments, just to help facilitate healing. Muscle relaxation, a lot of times help calming nerves down, painful syndromes. But unlike using something just on the skin, superficial, this is going deeper, having a bigger, meaningful response. And I pull that out.
How deep is that going?
So again, that's a 2-inch needle, and so I took it almost maybe like a 1/4 inch out of the skin, and I could have inserted that the entire way.
Okay.
Yeah. There are different lengths of needles depending upon what part part of the body I'm working on. If I was working on Dr. Jones's thigh, I would use a longer needle because I want to facilitate going through that entire muscle. And a lot of muscles are thicker, or I'm going through several of them. They're thicker than just 2 inches. Or I can run the length of a muscle, which we know how long muscles are there, so I'll use possibly a 3-inch or maybe 4-inch or 5-inch needle and utilize that as well, just to help, again, facilitate the best type of healing there.
And do you do electrodes on it also?
Yes, so with those needles inserted, I can actually hook that up and run current through those needles. Many people are very familiar with electrical stim, with like maybe sticky pads that are put on the skin, producing electrical current in order to help facilitate decreasing pain. This basically helps facilitate the muscle twitching because it's going through the muscle, which many times will help achieve maybe a larger result as well.
I see.
So that would be one technique that I could use in order to help calm a muscle down, relax it, and then I would combine that with some form of exercise.
Very good. All right. Well, thank you, Dr. Jones.
Thank you, Dr. Jones.
Thank you for being a wonderful patient there.
My pleasure.
And now the next patient is me.
That's right.
The real deal. All right. This is not an act, folks. This is the real deal. I was in pain last week, and he really did work on me, and I asked him to go ahead and demonstrate all the little magic techniques that he does. So, Chris, what do you want me to do?
Okay, let's get you lying down in the same position that Dr. Jones was in. Your head up here.
Okay.
So Becky, you came to me on Monday kind of having a very recent acute condition of your right knee. And she had the inability to straighten her knee completely, so it was probably stuck about 20 degrees from going to full extension, like this leg here. And she had the inability to straighten it. It was painful. There wasn't much visual swelling, like it wasn't really, really puffy. She just could not straighten it because it was very, very painful, and you don't force something like that. You also had the inability to bend it all the way as well because the same thing, it was very, very painful. And the tightness felt like it was on the outside of her knee, felt like it was on the inside of her knee a little bit, and in the back, so like multiple locations. She's been wearing this compression sleeve that I've had her wear since Monday just to help reduce a little bit of the fluid that we found because it really wasn't all that swollen. But that compression, joints like compression when they're hurt, and a lot of times that will help to calm them down as well. And Becky's pretty active, so I did not want her to be limited being up, getting out of our car, walking around, going up and down stairs, and have the knee swelling. So that slight compression usually helps to reduce that as well. So a couple techniques that I did to help Becky just regain the ability to straighten and bend her knee. First, walking requires the ability to straighten your knee, and we need to achieve full extension. Walking does not need the ability to bend the knee all the way, okay? Typically, walking only requires about 30 to 40 degrees of knee bending or flexion, as we call it, but it does need full extension. And so that's one of the first things we try to achieve to get back, okay? Many times we feel like I can't bend my knee, so I keep working on it. However, if you can't straighten your knee, that's going to be much, much more limiting. And that's one of the first things I try to work on. So one technique that I utilize to help improve that knee range of motion is just simple joint mobilization, or basically moving that joint into the correct mechanical positions that it needs to perform independently. So this bottom part of her leg, when she goes to straighten the knee, it's supposed to slide forward, and it just wasn't doing that. So one technique is that I just kind of grasp a hold of her tibia, this bottom part of the leg, stabilize the top part, and I just move her entire knee forward. And every joint should have a certain amount of play, should feel somewhat loose. Her knee felt kind of stiff and tight.
Should I be laying down?
You can, if you wanted to look at this.
Okay.
She was lying down just to be in a more relaxed state. Kind of takes the hamstring tension off as well. So I just mobilized her knee going forward. And what that did just kind of help improve the mechanics of her leg. And as I did that, I was able to slightly lower her leg each time. And again, I'm just shifting her tibia forward. That's called a mobilization, and there's different degrees of mobilization. There's always 1 to 5, and it depends upon how aggressive I am, or the amplitude that I'm moving, or at what point of the stiffness that I move into, okay? Hers was very, very painful, and so I was doing very light motion. I'm not trying to create pain. Most of the technique should be pain-free, so that way her body can relax. If things are painful, she's going to tense up, and that's not going to help us at all. So I was just gliding her tibia forward. Also, a technique is one I call kind of scooping. So I bend her knee up to 90 degrees, flex her here, and I actually just kind of twist her knee back and forth. Again, this is a very pain-free technique, but I'm just loosening the knee joint up in order to help facilitate it moving into full extension. Now, it took me a little while. I did this for about 10 minutes, going back and forth between both of those techniques in order to achieve her knee going into full extension. Another technique that I did was that when a knee is very painful and stuck, the muscles tighten up and it guards. So as I am trying to help the knee relax, I will use some compression on the knee joint in order to help it move a little bit better and move more pain-free. And this is a band that you can pretty much order this offline. And I utilize it on the bottom part of her knee joint. And I just wrap it around, not too tight in order to cut off circulation. That's very important. But I overlap it about halfway. And I go all the way down. Again, applying a little bit of compression. Starting at the knee joint, working my way down to the calf. And then I just tuck it in here. Now, right now, Becky is not in any sort of discomfort or pain, but when she was, I would take that knee and just move it through the full range. And what that helped was actually reduce her perception of that discomfort just a little bit. So I was able to actually get it a little bit straighter, and I was actually able to get it a little bit more into flexion or bending the knee. That compression that it applies to the joint and to the muscles, again, like I said, painful joints a lot of times like compression. Nerves that are really hypersensitive like compression. It makes them feel safe. And if they feel safe, they will relax. And if they relax, then you can take them through normal pain-free motions, which is good. It's very, very beneficial. You can do this on many, many joints, shoulders, elbows, wrists. Don't do it on the neck. Not a good thing. I actually had that question before. And after doing that to her lower leg, then I took it off and I put it above her knee as well. Again, it causes a little compression around the muscles, and as you're moving that joint through a normal range of motion, like bending and straightening it, it causes a little bit of friction rubbing, which is a good thing, warms it up, helps to reduce, again, that perception of pain, that perception of tightness.
And that's warming of the joint itself?
Really the muscles that attach to it.
The muscles,
Mm-hmm.
okay.
Because I don't actually wrap it all the way on the joint. I'm right above it, right below it, because all the muscles and tendons here, they attach past the knee. So I'm just kind of wrapping it around this structure here right above your knee. Again, not too tight, not cutting off circulation, so I could leave it there for a while, and she should feel just fine. Overlapping, halfway, maybe a little bit more than halfway. It's a long band. But I'm consistent with the tension I apply as well. Some people refer to this as flossing. That's just a technique terminology. So again, compression onto her quad, the adductor muscles that are inside, the hamstrings behind, her IT band, they all come down, attach below the knee, help to facilitate bending the knee and straightening the knee. And as that is wrapped on the knee, I'll just move it through its normal range of motion again, doing the same techniques. And for Becky, she had a decreased perception of discomfort and pain. Her knee started to relax more. So I was able to bend it further and stretch it. I was able to straighten it further and stretch it. Then I went through the same maneuvers, that scooping maneuver that I demonstrated, brought it back, did that same type of gliding mobilization that I showed a minute ago. I had her do a couple exercises of just bending and straightening the knee, and we started to see an improved range of motion in her knee as well. And then I take the band off, and now that her body has that sense that that movement is safe to do and okay to do, the idea there that it will stay with the band and the compression off of the knee, and it did. And over 24 to 48 hours, she was able to continue to further improve her mobility. When she came back for follow-up, she was still lacking a little bit of range of motion. And so another technique that I did before we did some exercises was some soft tissue massage, okay? And we all know that term. We think about we're using our hands and we're digging our hands into the muscle and just massaging it. And we do that in order to help relax muscles as well. An instrument that we can use to help facilitate that is a stainless steel device. And there are a lot of these out there. This one I like because it has many contours and points, and depending upon the surface and the area of the body that I'm going to use it on, I can choose a different side, and it's all in one. I don't have to actually have multiple tools. I use this with a slight lubricant. That way I'm not scratching the skin. And with her, I worked on her quadriceps, this muscle in the front of her thigh. I worked on these muscles on the inside of her thigh here. And then her IT band here. Again, I wanted to help them relax, massage them, stretch them, get them to relax so that way the knee was able to bend a little bit better and straighten. I use this portion here because I'm about to facilitate some massage on this large muscle. And I basically just did a scraping technique, and that's what this is called, just scraping. So I'm going with the muscle fibers, slow, controlled, keeping constant contact over the tendons here. Then I may shift to like a more of a pointed end. Again, this is very, very light. It's not painful. It shouldn't be painful because that's the whole thing I'm trying to reduce, her perception of pain. I'm not breaking up scar tissue. I can't do that with this device, but what I can do is help a muscle to relax, giving it a neurological input that will help facilitate relaxation. And I can go against the muscle fibers, with the muscle fibers. I can kind of stroke in different directions, really depending upon what type of result I'm wanting to achieve.
And that is amazingly light, and you think, why would that do anything? But it works.
Mm-hmm.
You know.
And if it was too hard, again, I'm just going to create bruising, and I don't want that. I'm not trying to create an inflammatory process. And as I scrape, I don't know if you can actually see it on the camera, but you'll see like her skin starts becoming a little bit red. So I'm actually creating and causing blood flow to kind of come to the surface here. And that's what I'm looking for. I'm just increasing circulation here, which always helps to facilitate good healing. Again, I can be more specific to a certain structure, and after doing that for a few minutes, I may check my range of motion to see where she's feeling that discomfort again, and if it's in a different area, then I may start working on that. Just like I demonstrated on Dr. Jones on his calf, I could start working in that same area that we just dry needled as well to help allow that to relax as well. Again, it's a hands-on technique and works very, very well. I can manage that much better through that device than sometimes just using my hands as well. Plus, it doesn't hurt me, so I can do it for a long time.
Right.
Becky responded really, really well to all three of those techniques. Joint mobilization, wrapping it with compression, going through the range of motion, doing some instrument-assisted soft tissue massage work. But all of that was just to help the knee move a little bit better. And then we performed a few exercises in order for her to maintain throughout the day to keep it moving correctly. Because if that's all we did, and I just allowed her to walk off the table and go about her day, and didn't really educate her on how to maintain it. You know, I say a physical therapist, the techniques that I perform, it's like opening a stuck window. We open it, but now if I don't educate her and teach her how to keep the window open, it's just going to close again.
Right, and we definitely don't want that happening.
No, because then you're walking around and you're always coming back to me to help do the exact same thing. So my job as an educator to teach you how you don't have to keep coming back to me, how you don't have to keep coming back and keep working on your knee. I want you to know how to do it yourself.
Right. Yeah. And I must say that the techniques that he just demonstrated really do work. And for me, within a couple days, I was able to move normally, and I injured myself running. But one thing that you said, that if the more fit you are, probably the quicker you're going to get better.
Yes, you responded so well, so quickly to the techniques and the exercises, because Becky is constantly moving. She's constantly exercising, and her body's used to healing very, very quickly. It's used to moving. So we were able to create an environment for your body to start healing more rapidly, and then allowed your body to heal.
Yeah.
And you responded so quickly to it.
Yeah. So I want people to know about Chris Wolfe and his new sole proprietorship, his business, which is in Melrose area, also in the building that PhysioFit is in, and where Todd has his Endeavor Performance. It's all there, and it's and you're going to have a website shortly?
Yes, that is being constructed right now. Should be up and running about a week and a half. But wolfept.com will be my website name. WolfePT is my business, and allows me to see clients, patients on a one-on-one basis, providing physical therapy treatment, and helping you just move better.
Right. And there's a platoon of people that I swim with, bike with, run with, that all testify that he's really very gifted and very, it's an amazing thing. And it's not what you think. It's there's a lot of amazing techniques that I've never heard of, but it's just like, okay, you know, it works. So any last thoughts that you have on what you'd like people to know about you?
You know, again, we want people to keep moving. That's our my main job.
At any age.
At any age, young, as we age, the body wants to keep moving. The body wants to heal. So create an environment for it. Keep moving. Learn how to move in a pain-free way. Don't be afraid of discomfort and pain. That's your body talking to you. But and learn how to do that better.
Yeah. Well, Chris Wolfe, thank you very much.
Thank you.
Transitions, body, mind, spirit. Thank you. Yay!
I got 2 treatments in one day on your knee.